session. You're all going to be on mute since there are a lot of us, so that's also why we are going to be using the chat box to make sure the session today is going to be as smooth as possible. If you're going to be leaving any comments or questions, we request please be respectful and mindful of each other, and let's be sensitive. We would really appreciate if you are able to do that. And finally, the slides and recording will be shared with you. If you would like that to be shared with you, please send us a request. Just drop us an email at info@dbgm.org. Giselle? So just a quick recap of our program for today. The first session is going to be by Ronnie-Gregory James from the Mayor's Office of Immigrant Affairs. The session will be on fierce access rights, followed by Dr. Rischa Gottlieb, COVID-19's effect on our mental health. And we'll close the session just before we do the Q&A with McMorrow from the Mayor's Office, My Needs Now Resources. So then we'll have the Q&A session and we'll pretty much end the session with that. So without further ado, we'd like to move on to our next session with our presenter, Ronnie-Gregory James. Ronnie goes by he, him, his pronouns. Ronnie is also the community organizer for the Mayor's Office of Immigrant Affairs. Ronnie, do you want to take it away?
Thank you so much for that introduction, and thank you everyone for being here. I also want to thank the organizers specifically for creating this opportunity for us to share these resources. I'm going to share my screen now. Okay. Can everyone see? Awesome. Okay, so as folks have already said, my name is Ronnie and I'm an organizer for the Mayor's Office of Immigrant Affairs. I work mostly in Central Brooklyn. So if there's any resources that you or your community may need, feel free to check in with me. We work across the city, so we can definitely connect you to an organizer in any of the 5 boroughs.
Hi, Ronnie. Very quick. Have you shared your slides on the screen? We don't see it.
Oops. Can you guys see?
No, we don't see it.
This is so weird.
I think Ronnie's just figuring out the slides. Let's just give Ronnie a couple of minutes. Thank you, folks.
How about now?
There we go. Thanks, Ronnie. We see
Awesome. Sorry for that. So as I said, I work for the Mayor's Office of Immigrant Affairs, and I'm happy to connect with anyone in any of the 5 boroughs to any services or resources that they may need. So with that, I'm going to be covering resources available to anyone regardless of their immigration status. And we're going to start with guidance on and treatment. The city's guidance is, of course, social distancing. That is the best and most prevalent tool we have to combat the COVID-19 pandemic, as well as to really just protect ourselves. We're also asking that you maintain a 6 feet distance between yourself and others, as well as wearing face covering. Now that this doesn't have to be a mask, it can just be a face cloth. That alone protects yourself from just touching your face. And one of the things that is available is an NYC call line, which is 844-NYC-4NYC. You can call this line to discuss COVID-19 symptoms and receive medical advice and assistance regardless of immigration status or insurance status. So if you can't afford insurance or you're undocumented, you can use this service regardless of your immigration status. And the next thing I want to talk about is a free texting service. If you text COVID to 692-692, you can get ready updates with information about what is happening across the city. So you get information about city services, as well as just updates on where we are with fighting the pandemic. The last time I got a text, I want to say, is at 12:30 today. So it's a very active text line. More on guidance and treatment is that the city is expanding testing sites across the 5 boroughs. Based on zip code to DBGM, the closest testing site would be NYC Health and Hospitals, Gotham Health, Dykeman Clínica de las Americas. This is a testing site. This is one of many, and the list was updated within the last 2 days. And more sites are set to roll in as we move into next week. You can also get this information here at this this link with a full list of testing sites across the 5 boroughs. As we continue into the pandemic, there's a bunch of concerns that surround immigration. And one of the main ones we're fielding is public charge. Now, a public charge is a test that USCIS institutes largely when folks are adjusting their status. What we have from USCIS themselves is that getting care and treatment will not affect you as you are adjusting your status. So if you seek treatment, if you go to any of the city's testing centers, that will not affect your ability to adjust your status now or later. And if you want like specific reference, USCIS, this is a link here where USCIS on their page themselves say that that's treatment and preventative services for COVID-19 will not negatively impact the outcome of any persons subject to the public charge test, even if the treatment and or preventative services are provided or paid for by one or more public benefits considered under the public charge test. That's legal jargon just to say that if you seek services or treatment for COVID-19, it will not impact your immigration status. Health and hospitals. Health and hospitals are one of the main points where you can get access to treatment and services, even beyond just COVID-19. No matter your immigration status, the city maintains that you can seek healthcare regardless of, without fear that it will impact your status, or that if you can't afford it because you can't pay a monthly premium on your insurance or just generally afford insurance, you can still seek care at health and hospitals without fear of being denied. And this is true for all types of healthcare, healthcare services, including emergency care, doctor's visits, medication, long-term care, and hospital stays. And again, more information can be found at the link below. This presentation will be shared with folks later with all the slides, so you can go through it and select the link that most applies to the information you want. The next thing on immigration concerns is Action NYC. Action NYC is a free city initiative that is available for folks to get legal services legal services or legal information about about how COVID-19 could affect their status. It is not limited alone to COVID-19. So if you're in the process of adjusting your status and you need a lawyer to help you with the paperwork, you can contact Action NYC for that assistance. The same way, if you're in need of any other legal immigration services, you can contact them directly at this number. At this number, or calling 311, and they would be able to connect you to a legal service provider. Okay. The biggest service that I want to touch on today is NYC Well, which is a mental wellness service that the city operates. If you're having trouble coping with COVID-19, honestly, I'm being cooped up is doing some like annoying things. It's a lot. But like, this is a way for individuals to seek care without fear that their status or their ability to pay for care will be affected. So you can use NYC Well to get access to crisis counseling, peer support, short-term counseling, and connection to ongoing mental health and substance misuse services. So it's an all-around great resource if you're looking for support in mental wellness. You can give them a call here or text them at 65173. The next thing that I want to talk about is housing and eviction. It's important to know that all COVID-related eviction proceedings and pending eviction orders have been suspended until August 2020. So what that means is folks should not be getting evicted, and if you are, you can seek action. The city has activated a new hotline to assist tenants, and you can call 311 to receive guidance on how to proceed if your landlord or if the person you rent a room from, because this applies to folks who are renting rooms. If you are in any of these categories and you are facing eviction currently, you can seek assistance by calling 311 and asking for these services. Additional support is to be provided by the mayor's office to protect tenants who can connect callers to free legal help. And these services are available in multiple languages. So as when you make contact, you can ask for the language that best suits your needs. Feel free to cut me off at any point. I think I'm over 10 minutes. But I can continue sharing information.
You have 2 more minutes.
Pardon?
You have 2 more minutes, don't worry.
Awesome, yay. NYC meal hubs. So these are places where you can get meals for three square meals per day. These hubs are citywide, and they're open to all families. So there's a misconception that they're only for children and students, but this is a service available for all families. NYC food delivery assistance. So this is for if a program available for anyone who's unable to go out of their homes and get food brought and delivered to them. So you can visit NYC food. You can visit NYC COVID-19 food assistant resources. This link right here. This will take you directly to the program, which is called Get Food NYC. You can also call 311 and say get food, and they will get you connected to a service provider. Important to know that all NYC public schools are closed until the end of the school year. Students will continue their education remotely. And if you or a student is in need of technology to complete their learning, you can request those. And there's been a lot of pitfalls in this program in terms of getting folks their iPads, which is why the city also launched a feedback channel, so that whatever drops in service that you're feeling or is being affected by you can report that also on this link. Just another reminder that this presentation will be shared with you, so you would be able to access any of the links on the slides. Big up on this one, and the 2020 census. It's such a huge part of how money is allocated to our communities. The billions in federal funds for public projects such as hospitals, schools, housing development, roads and bridges, basically the development of our communities. A lot of funds come from that, and Brooklyn tends to be one of the least captured boroughs, and really federally, it's also one of the least captured geographic areas. So we're also pushing this out, that regardless of your immigration status, you can get your voice heard in the 2020 census and have federal funding be allocated to your communities. So like, I would say like for 10 years ago, we were experiencing a lack of funds in education. That was also 10 years ago when the 2010 census ran out. came out. And again, Brooklyn was not captured. We were experiencing really a desert in education then, and we're still experiencing that a lot because we are there's a fear in the community. There's a fear in the immigrant community to participate in government activity because of the fear of deportation. But the census does not, you do not have to provide your citizenship or your status on the 2020 census. You can complete it online. You can also just wait for it to come to you in the mail. But it's a great way for you to get your voice heard. And it's often the first places that immigrants like myself, and I'm sure all of you on the call maybe are able to participate a bit more freely in the US governments.
Okay, Ronnie. Yeah, perfect. You're right on time.
Hey, so thank you all for listening. I'm Ronnie. This is my contact information. And if you reach out to me or Giselle, you'd be in great hands to get resources to your community. Thank you.
Thanks so much, Ronnie, for that wonderful session. It was very informative. We are going to move on to the next session. Just going to give Giselle a few minutes to pull the slides up. Thank you so much, Giselle. I see that a lot more people have joined. Thank you so much for coming, taking your time to join us today. Quick reminder, the session today is actually recorded. If you want the slides or the recording, please drop us an email at info@dbgm.org. So the next session is actually from Dr. Rischa Gottlieb. It's amazing to have her join us. She's the founder and clinical director of New Perspective Psychological Services. Dr. Rischa, why don't you go right ahead? Hi, Dr. Rischa, you're on mute.
Thank you. So through the pandemic, I've mostly thought about how to support people's emotional health and build up our resiliency. I know that you're controlling the slides. Is there something that I can say or do so that you know when to change them?
Just say next, Doctor, and Giselle.
All right, then let's get started and go next. So a lot of people have been thinking about COVID-19 as something that's a sort of equalizer, kind of from the perspective that illness affects us all. But while the illness itself might not care about our personal characteristics, I think the opportunistic nature of illness and of the virus itself really lays bare what inequity means for us on a day-to-day level. The coronavirus is taking advantage of the same things that honestly increase our stress and decrease our emotional resources in our daily lives. Those of us who identify with multiple marginalized communities, those of us who are immigrants, who are LGBTQIA folks of color, find that we have our resources taxed from multiple resources, multiple ends. Next. I don't feel like I can talk about mental health without talking about our vulnerabilities, about talking about why we're being taxed. We are being taxed both emotionally and physically because we're at increased risk for health complications, because we're at increased risk for economic instability, and that can contribute to anxiety and depression overall. It is not possible to ask somebody to take care of their emotional well-being when they have very valid concerns that come August, they may be evicted, or they have concerns about food insecurity. You can't ask us to take care of our emotional health without acknowledging that we have fewer familial resources to rely on in our social support networks. What that means is that when we're in a time of need, many of us find that we don't have very many people we can call on without feeling like we're in imposition. So that makes us less likely to reach out in general. And when we do reach out, it means that we have fewer people who are really willing to extend larger resources, whether those are financial resources, whether those are physical resources of being present, even at a social distance, or emotional resources, people who are really willing to listen, to express that they are present no matter what, to express that they care no matter what. We also experience discrimination across settings, including healthcare settings. What that means is that we are less likely to have a physician to call to say, you know, I'm feeling tightness in the chest. I don't know whether this is anxiety or COVID. Many of our peers, our Caucasian peers, our heterosexual peers have a physician who they have a long-standing relationship with. That also means that we might put off seeking care for both physical and emotional health. And the last thing is that our community and personally, we are experiencing grief and loss, and the loss of our rituals surrounding the end of life. That has had a profound effect on what it means for us to both celebrate the lives of the people that we've lost, but also mark the end of something important for ourselves. Next slide. So some of those economic vulnerabilities that I mentioned before is that 40% of us are likely to work in the 5 industries that have been, 40% of us work in the industries that are affected the most, versus 22% of our heterosexual peers. We are also more likely in general to be living in poverty or paycheck to paycheck than our heterosexual peers and than our Caucasian peers. We're more likely to have pre-existing conditions. We're at greater risk for having HIV, obesity, high blood pressure, asthma, and diabetes. The last one is really where I come in. All of those things are things that we know. We know that we are at risk when we have asthma, and that might naturally increase our anxiety. And just because that anxiety is natural at this time doesn't mean it's not deeply uncomfortable. The effects of stress and trauma, and stress includes the stress of worry about loss of housing, worry about loss of life, those are additive. Once one thing starts, we start a kind of baseline of wearing away at our emotional resources to cope. Next slide. So due to our increased risk for discrimination, victimization, we have to understand our own reactions within this context. That means treating ourselves with a trauma-informed response to our care. We can end up feeling as if our reactions are out of proportion to what's happening. And sometimes they are, but actually they're not out of proportion to what is going on in our lives and what has gone on in our lives before. If you're somebody who has been isolated due to rejection from your family or from peers where you grew up, it is perfectly normal to feel much more overwhelmed than your friends elsewhere. Social isolation due to COVID might bring up those kind of memories. Remember to tell yourself that you're not alone in what you're feeling, even if those emotions feel out of proportion, and you're not crazy. What you're feeling makes sense. Trauma means that we respond more intensely because we're expecting something, the other shoe to keep dropping. Next slide. We're also at increased risk because we might be sheltering in unwelcome places. So some of us might live with family members who are not particularly supportive or who are actively physically or emotionally abusive and have developed a lot of coping resources around leaving, around spending our time with peers who are supportive at their houses, in community centers, even at theater clubs. Those are things that are no longer available to us. Others might be leaving college or leaving the city to go back home. It's really important that we keep in mind what signs of unsupportive and unhealthy environments are. So if folks around you are making unreasonable demands, and unreasonable includes be less queer. if they're nitpicking at your clothes, your hair, your work, if when you tell somebody that they're hurting your feelings or to just stop or that you need more space, they're telling you that you're too sensitive or too emotional, that you're crazy when you're expressing hurt. If they're inviting you in what seems like a friendly way to watch something that they know is going to attack your identity, if they're dismissing your requests and telling you that what you need, whether it's a little bit of space or honestly to need to put on an outfit that you feel empowered in, is ridiculous and unmerited. If somebody is refusing to accept and acknowledge your opinions and ideas are valid, even if they're different from their own, if they treat you like an inferior, if they tell you that your thoughts, your opinions don't make sense, are stupid, are illogical, if they tell you that no matter what you do, there's something else for you to do better, that is an environment that's emotionally abusive and raises our stress. We are not meant to live in an environment where people who purport to care about us tear us down. And it's absolutely normal and natural to start believing that you're not good enough when somebody says that, even if logic brain knows that it's not true. So what to do when we're stuck in those spaces, which is located on the next slide. So 7 ways to cope while living with an unsupportive family. Like I said, a lot of us have kind of created some emotional resources around leaving. Now it's time to create them around staying, because there isn't much option. Make your mental health a priority. Don't worry about making somebody else comfortable. Think about the small things that you do that affirm who you are. Whether that means wearing a gender nonconforming outfit that you feel empowered in, even if the people around you don't particularly care for it, or if it means dancing around in your room. Think about the things that are available to you that remind you of the parts of your personality that you feel confident in. Establish boundaries. Let people know that certain topics are off limits. A lot of times we tell ourselves that we have to be fair. So fair might mean that be accommodating if you think that somebody wasn't raised to believe that LGBTQ folks are allowed to exist. And it might not be fair to ask them to show respect. Remember that you're included in what's fair. Fair does not just mean be accommodating to another person. Fair means include what you need. If you have the emotional energy in a moment to politely check a family member and ask them to stop doing something, or maybe even highlight why a joke isn't funny, do it. But also don't yell at yourself if you don't have that energy. You have every right to walk away without saying anything, or bury your head in your phone or a book without having to address everything in the moment. Try not to engage. If you notice that somebody is trying to draw you into an argument, don't try and convince them that you've done enough. Don't make apologies if apologies aren't necessary. Honestly, you're probably never going to convince them anyway. So a lot of those times you're kind of telling yourself that you could be doing better when that's not necessarily true. Oftentimes it's not true at all, which kind of leads into 4 and 5. Stop blaming yourself and realize that you can't convince somebody else to value you or to change. So when family constantly criticizes you, it's natural to believe that there is something wrong with you, but the problem was never with you to begin with. Their words and actions relate to them, not you, and not anything that you've done to produce them. A lot of times the idea that if we were just a little bit better, then things would be very different is a lie that they tell us and a lie that we tell ourselves. If somebody closes themselves off to change, if somebody closes themselves off to you, that's not something that you can convince them to do otherwise. It's something that you have to accept. Not to say that acceptance doesn't come with a lot of very real pain, but that acceptance is also a really important part of your own self-preservation. There is often nothing you can do to convince somebody who's closed themselves off that your life is worthwhile. Our lives are all intrinsically worthwhile. Anybody who tells you that you have to prove it, or anybody where you feel as if you have to sanitize your life in order to be accepted, doesn't share in that general belief about humanity and won't share it about you in particular. Focus on having short-term and long-term exit strategies. Right now, know that this period of time is finite. It will end. We will not be stuck indoors forever. We will not be stuck indoors with unsupportive people forever. Think about your exit plan. Does your exit plan involve returning to college? Does it involve bolstering your career? Does it involve even chatting with people who are excited to maybe get roommates again? Keep in touch with your supportive friends and partners. Lean on the people you trust. Oftentimes you'll find that they lean back. Let's go on.
Rischa, you're actually at your mark for the 10 minutes.
I always have a lot to say. All right.
If you want to wrap up, you can.
A lot of what I had to say next is about making the time meaningful for you. Be sure to validate yourself and what you're noticing. For example, that was just what it's like to live with folks that might not be supportive. A lot of us have maybe created some necessary distance and might be honestly feeling a little bit sad. If you think that it's right to reach out to a family member where it felt healthy to create distance, respect that. Remember to treat your emotions with the same respect that you treat somebody else's. Take time to make this period contribute to your life as a whole. Try to accumulate some positive experiences that are possible right now and build a sense of mastery. Do something every day that feels worthwhile. And a lot of times we tell ourselves that things that sound easy on paper, whether that's doing laundry or cooking for ourselves, our roommates, our families, we tell ourselves those things are just normal, not worthwhile. Those things are hard. It is really, really difficult to take care of ourselves and to take care of others on a daily basis. Call people, don't just call for yourself, but call to ask about how they're doing. Spend some time really deepening the relationships that you have in your life that are worthwhile. All right. Thanks for the time.
Doctor, thank you so much for that. I really benefited from the ways of coping. I thought that was really, really useful, especially given the current situation that we're in. So thank you so much. So our next session is from an interesting friend of mine, a good friend, Matthew McMorrow. He's been with the Mayor's Office for a while. He's currently the Senior Director for the Mayor's Office of Community Affairs. Matt, it's all you.
Hi, Julian. Great to see you again. Hope you're doing well during this crazy time we're living through. Hi, everybody. Again, I'm Mayor de Blasio's Senior Advisor for LGBTQ Community Affairs. My pronouns are he and him. Normally, I'd be preparing for Pride events this time of year, but a lot has changed, obviously. The mayor didn't want to cancel Pride events this season, but we really couldn't, in good conscience, allow large public gatherings to take place. Obviously, we need to prevent the spread of COVID-19. Now, most people I've talked to are disappointed by the cancellations, but I think most people also understand. This is a virus that is affecting so many of us, so many different communities, and we really do need to protect ourselves and our families and our communities. You know, it's kind of amazing. You know, as of yesterday at 12:30, the number of positive cases in New York City is 185,206. And we've lost over 15,000 New Yorkers to COVID-19, and we suspect another 5,000 deaths are likely due to the disease. So what is really what's really scary, it's really a scary time right now to be living in New York City. We've had 20,000 New Yorkers lost in roughly 2 months. And that produces a lot of stress and anxiety. Anxiety about catching the virus, anxiety about losing sources of income, grieving the loss of a loved one, tensions caused, by spending so much time with your family and roommates, the uncertainty of the future. So what everyone at City Hall has been focused on in the past 10 weeks, is finding ways to alleviate some of that stress and address the concerns that so many of us are feeling. And we're developing solutions and connecting people to resources that help everyone get through this pandemic, to show that we're really in this together, even when we have to have physical distance between us. Now, I know Ronnie already covered some of these resources, so I'm not going to try not to repeat them. Obviously, Ronnie and I both work for the mayor's office, so it's natural that we're going to have some overlap. But many of the things I'm going to share, I don't have a slideshow, I'm sorry, but they have websites or phone numbers attached to them. I will ask Antoine to include my most recent email on the city's response to COVID-19, which will have links and more details about how to access the resources I'm sharing. And I send these updates about 3 to 4 times per week. They're a compilation of various reports and updates and resources from various sources across city government. You'll see a link on my email that Antoine shares where you can join my distribution list so you can keep up to date with the latest. Just to reiterate something that Ronnie shared, 2 of the most important ways to learn of the city's response are if you have symptoms or questions about COVID-19, call 1-844-NYC-4NYC. That'll connect you to a healthcare provider from Health and Hospitals, and they can listen to you about your symptoms, answer any questions you may have, and help guide you for the next steps. The second resource, as Ronnie said, is text COVID at 692-692 to get important updates on COVID-19 related updates sent straight to your phone. And if you want those in Spanish, you can text COVID ESP to the same number, 692-692. So one of the things that we launched this week is the NYC Unity Project's LGBTQ COVID-19 online guide. Now this guide was created by the NYC Unity Project, which is a mayor's office initiative in partnership with representatives from 15 different city agencies and over 200 LGBTQ community partners across our city. It's a dynamic, mobile, accessible website with over 100 listings of LGBTQ+ affirming programs and services. These are both city and private nonprofit resources. And they're listing, and that continue to be available during this stay-at-home period. They're both local and virtual. The listings are organized into several categories with information on LGBTQ affirming services for mental health, physical health and wellness, sexual health, peer and community support, food assistance, legal services, housing and shelter, and financial and funding opportunities. So you can access this online guide at nyc.gov/LGBTQ/COVID. Again, that's nyc.gov/LGBTQ/COVID. So that on that website, you'll find a lot of resources that are that specifically address the LGBTQ community. More broadly, the mayor's office has acquired 7.5 million face masks and face coverings. We are distributing those at NYCHA facilities, DOE grab and go sites, in parks, Mitchell-Lama buildings, grocery stores, and as part of a social distancing enforcement, many of the police officers and park police will have these on hand to hand out to people they see who do not have face coverings on. There's also a map that will be on my email that shows where the distribution sites are, and you can get your own face coverings. You can also contact me, and I can actually deliver some to an organization that may need some. We are also in the process of hiring contact tracers. We're looking to hire 1,000 contact tracers immediately, particularly people with experience in the healthcare field. We'll also be training people from a variety of city agencies to complement this work. These tracers will interview people who are positive, identify others who may have been exposed, and follow up with those people in turn to be tested. And hiring will be done through the Fund for Public Health. Again, I'll provide more information on the email that Antoine shares. We are also, the MTA has, as of last week, closed stations from 1 a.m. to 5 a.m. For deep cleaning of the subway cars. We have DHS outreach teams who are in the subway system to protect our homeless New Yorkers. So far, we've just in one night this week, we engaged 370 people, and 213 of those people accepted services. 178 people went to shelters, and 33 were brought to a hospital. So, so this is a time where we are connecting homeless people to services and to shelter, so they do not have to sleep on subway cars. We are also opening streets across the city. We'll continue to build upon, with the goal of opening 100 miles worth of streets. This will give more pedestrians more space to walk around while practicing social distancing. You can find a map of where those locations will be. Some are inside parks, some are adjacent to parks, but others are around the city in various neighborhoods. I won't cover food because I think Ronnie covered that in his presentation. We're also, and I think testing sites, we are continuing to build upon the COVID testing sites through our 11 H&H hospitals across the city. And we are also ramping up our development of antibodies tests across the city. So there will be, you'll continue to see new testing sites pop up, especially in communities that have been hardest hit. Also, the TLC Driver Resource Center is available now. It offers a wide range of services to all TLC licensed drivers and medallion owners, a community that's been hit very hard by this outbreak. This resource center includes legal services, financial counseling, health and mental health referrals, and public benefits application support. So if you know of anybody who's a TLC driver, please direct them to that resource. Also, we are continuing to distribute remote learning devices. DOE has identified approximately 35,000 students with disabilities in religious and independent non-public schools who are eligible to request a device. So you can reach out to 718-935-5100 to request an iPad or a laptop to facilitate remote learning during this time while schools are closed. So grab and go meals for all New Yorkers. No one's turned away, and participants are able to pick up 3 meals. To find a location, you can text NYC Food or Comida at 877-877 to find the nearest site for to pick up meals. Kosher meals are available at 18 of those sites, and halal meals are available at all 400 sites. And we're going to continue to increase capacity.
Matt, I just want to let you know you have 1 more minute left.
Okay, so so needless to say, I think I'm just giving you some of the things that we've been working on, really to address the biggest concerns and even the smaller concerns that we are hearing from community members across the city. We continue to update and build out resources as much as possible. And again, there's even more that will be included in my email distribution, which has a lot. I'm just scrolling down, but just to close out, I want to say 2 things. One is, every night at 7 o'clock, very soon, in fact, clap out your window, play an instrument, sing a song, whatever it is to thank our healthcare workers, our first responders, our essential workers, all of whom have really put themselves in harm's way so that our city can survive. And I think, by doing that, by having all of us doing it, it does create community that a lot of us desperately crave right now. And the second thing I'll add is that the federal stimulus bill that's being considered in Washington, call your representatives, make sure that they support this. It has a lot of direct aid for New York City that will benefit our food, it will address food insecurity, housing, transit. It'll provide benefits for those of our first responders and healthcare workers. So please make sure that you reach out to your Congress member, your senator, to make sure that they're supporting it. It's very important. So thank you all for hanging in there. We're going to get through this together.
Thank you so much, Matt. That was really helpful, very beneficial. I'm actually subscribing to that distribution list. It's amazing information there, really helpful. So thank you. Now we are going to move on to our Q&A session. Because of the number of people that we have, we are planning to have folks who have comments or questions to leave them in the comment box, the chat box, and we will read them out accordingly. Giselle, is that activated for folks already?
For some reason, I'm not seeing a chat box. So I guess if people would just like to say it, just unmute yourself and say the question, because I'm not seeing, for some reason, that feature on the Zoom.
So I have a suggestion. You can just raise your hand and I'll call out your name. So that way we keep this a little bit more organized. Otherwise, a few people might unmute it. So let's do that. Who would like to, anyone with a question or comments? I don't see any raised hands.
I believe Manny has a question.
Yeah, Manny, go right ahead.
Hi, can everyone hear me?
Yes, Manny, we can hear you.
Hello? Yes, I'm not great at this technology. So I really had more of two comments. One, I think it's really great that the Press Gay Men put this together, the organization. I think some of the information was really valid. I've taken a lot of notes as it's been written down to share, and I think that's the purpose of this, for each one of us to take back to the lot of groups that we deal with, particularly around how to deal with isolation and those feelings that people have in these really challenging times. So I'd really like to congratulate for the organization for pulling this together. The second thing I think that is really something we could take from here is trying to get the federal assistance that the city needs desperately. A lot of services where normally with this budget process, when there's something going on or issue that we want, we can just run the city hall and try and get the city council and mayors to work it out. There really just is no money. So I think the suggestion that we reach out to our federal legislators and ask them to strongly push for a stimulus bill that's going to recognize the terrible financial situation that the city's in is helpful, particularly if not, we're not going to have any recourse if there's going to have to be some kind of adjustment in services that deal with a lot of communities that we're involved in, that we represent. So those are the two things I just wanted to weigh in for. Thanks again, Antoine, and everyone else who helped put this together.
Thanks, Manny. Rebecca, I see you, but I'm just going to open that up to, are there any feedback from Matt, Ronnie, Doctor, just for Manny?
Yeah, thank you, Manny. Good to see you. Yes, thank you. Yes, we do need that stimulus bill. That we are responding very aggressively to the COVID-19 crisis, but we're also spending a lot of city money and not getting much in since we've had to close down so many businesses. That's really eaten away at our tax base. So So yes, I mean, it is a dire situation. We really do need our federal government to come through. So thank you for reiterating that. I implore everybody to continue to really sound the alarm because we really need it. Thanks.
Ronnie, did you want to say anything? Did you want to add anything before I call on the next person?
Not really, no.
Okay, all right. Thanks. Rebecca, go right ahead, unmute yourself.
Yeah, thank you very much to Rischa. Okay, so I'm actually from Nigeria, and I love the presentation on mental health and COVID-19. But the question is, for how long are you going to keep hesitating when the environment you're in is not emotionally supportive, you know? So I don't know, for how long is that supposed to last for? Because you could be in an environment today, it is not friendly, you hesitate. Tomorrow, are you still going to keep hesitating? So for how long are you actually going to keep hesitating an unfriendly environment for? Thank you.
Hi, Rebecca. Quick question. Did you want to direct that question to someone specific on the panel?
Yes, to reach, I'm not sure I pronounced it well.
You did, which is my, exactly.
Oh, okay. Thank you.
You know, I don't know that, I think some of the hardest thing about this is that even though we know it's time limited, we don't really know what time limited means. And that can be part of why a lot of people are feeling anxious and honestly a little bit hopeless right now. One of the things that's really beautiful about people is that we can get used to a lot of things. That does mean that sometimes we're vulnerable to getting used to things that are unhealthy for us. But when we're in a prolonged period of stress like this, our brains and our bodies are meant to accommodate a lot. And we can absolutely get through it. It's just not easy. And it's even more difficult for us when we have those other things that kind of wear away at us. The things that can help make it feel shorter is focusing on the future and focusing on what you can do now that is pleasant, and not as much on the things that you very badly miss. I hope that helped.
Oh, yes. Thank you, Richard. Thank you.
All right, Kachi, we have you up next. Maybe if you would like to just let us know if you have the question or comment is directed at a specific panelist, that'd be helpful. Thank you. Go right ahead. Unmute yourself, please.
Okay, thank you very much for this online forum. It's so appreciated. My name is Kachi. I'm Nigerian. And then considering the kind of hostile environment we have in Nigeria, that's talking about the LGBTQ community. In fact, recently we've had an uprise in the number of violence against gay men in Nigeria. In fact, as of today, we're handling a case where 12 persons have been arrested in the last 3 days. Yeah, just because they feel uncomfortable in their houses, they want to go out to go stay with some friends because their house is not good for them. And then in the process, they were rounded up. And then rounding them up, they were used to get other people into the police custody. And then the second question is, the second concern has been the high number of LGBT persons in Nigeria who are living with HIV. So what message should we just give to them right now? Because there's tension everywhere. Every day you get a call in the office. What am I going to do? What do we do? Are we going to die if we contact the COVID-19 virus? Are we going to die immediately? So sometimes it's really overwhelming. And then just a simple message like, okay, what should we tell them now? Because it's even confusing from an angle of a psychologist. What should we do? So this question goes to Rishi. Yeah, thank you.
I think the most powerful thing that we can do for people is kind of tell them that we hear them. Even if we don't have a concrete answer or thing to do, one of the hardest things is that when real things happen in life, sometimes there isn't a lot of action to take. There is absolutely action around social distancing. There's absolutely action around making space for ourselves, but it can feel like not enough when you're on the phone and somebody is expressing their real anxiety, and the biggest thing that you have to say is, I'm here and I hear you. I would say that over and over and over again, and remember that listening and saying that is enough, even if it doesn't feel like it in the moment.
Thank you so much, Doctor. I hope that provides some answer to your question earlier. Do we have any other questions, comments from folks on the floor? Well, it looks like we don't have any other questions or comments, and it's kind of perfect timing. It's about 7 o'clock, actually. Yeah, I was just about to say, man, should we all clap? You know, maybe we should unmute and just give a applause. Well, so folks, thank you so much. We have a very short poll that we're going to show, that's going to come up on your screen. If you could just take just a minute, just to quickly answer that poll, that'd be really helpful. This is going to be very helpful for our future sessions. So you just select your question and just click submit. Giselle, should we go on to the next slide? Great, so these are a list of our upcoming sessions. If you are interested, please don't hesitate to email us. We'll provide you more information. And with that, we also have our conference that's coming up. Giselle, the next slide. I think there's some information on our upcoming conference in, yes, thank you, in October. So this is our annual conference that we have. It's in my conference. This year, the theme will be the environment and me. It's going to be on October 8 and 9. So we are actually having folks who are interested submit abstracts. So if you know anyone, please share this information. We are looking for abstracts right now for the session. And we'll be accepting this until between April 1st to May 31st. So with that, we want to thank everyone for taking the time, for joining us today. Again, if you have any questions, please don't hesitate to drop us an email at info@dbgm.org. We'll be more than happy to provide you with any answers to your questions, or we can even forward them to the panelists if you so wish. We can also send out the recording for today and the slides. I want to quickly thank all of the panelists for today's speakers. Thank you so much for taking your time and sharing some of this information. It's extremely valuable given what we're going through right now. With that, have a wonderful evening. Thank you, everybody.
Thank you.
Thank you, Julian.
Here.
Thank you.
Thanks, Julian. Thank you, guys.
Thank you, everyone.
Thank you, everyone.
Thank you.
Thanks. Giselle, can you hear me?
Yes, I can. I just got all the results from the poll.
Okay, cool.
Mm-hmm.
Is it something you can download and share?
Hold on. Let me just turn off the recording.
Yeah.